Indomethacin suspension is a medication used to relieve pain, swelling, and joint stiffness caused by arthritis, gout, bursitis, and tendonitis. It belongs to a group of medications known as nonsteroidal anti-inflammatory drugs, NSAIDs. By reducing these symptoms, it helps you to do more of your normal daily activities. If you are treating a chronic condition such as arthritis, it's important to ask your doctor about non-drug treatments and other medications that can help manage your pain. The recommended dosage and timing for taking this medication will vary depending on your specific condition, so it's crucial to follow your doctor's instructions carefully. Before starting to use indomethacin, make sure to read the medication guide provided by your pharmacist. It's important to shake the bottle well before each dose and measure the dose carefully with a medication spoon or cup. You can take this medication with food, right after meals, or with antacids to prevent stomach upset. The dosage of indomethacin is based on your medical condition and response to treatment. In children, the dosage is also based on weight. To reduce the risk of side effects, it's important to use the lowest effective dose for the shortest possible length of time. Do not increase your dose or take it more often than prescribed. For chronic conditions like arthritis, continue taking it as directed by your doctor. It may take up to 4 weeks of regular use before you notice the full benefits, especially in conditions like arthritis. If you are taking this drug on an as-needed basis, remember that it works best if used at the first signs of pain. Waiting until the pain has worsened may reduce its effectiveness. And as always, make sure to tell your doctor if your condition worsens. Some common side effects of indomethacin suspension may include upset stomach, heartburn, headache, drowsiness, or dizziness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. However, it's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. It's important to monitor your blood pressure regularly while taking this medication, as it may raise your blood pressure. If you notice any significant changes, be sure to inform your doctor. Seek immediate medical attention if you experience any serious side effects such as changes in hearing, mental/mood changes, difficulty swallowing, symptoms of heart failure, signs of kidney problems, unexplained stiff neck, or symptoms of liver damage. In rare cases, a serious allergic reaction may occur. If you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. As always, it's important to consult with your healthcare provider for any concerns or questions regarding your medication. Indomethacin suspension is a nonsteroidal anti-inflammatory drug that may rarely increase the risk for a heart attack or stroke. This effect can happen at any time while taking this drug but is more likely if you take it for a long time. The risk may be greater in older adults or if you have heart disease or increased risk for heart disease. It is important not to take this drug right before or after heart bypass surgery. This drug may also rarely cause serious bleeding from the stomach or intestines without warning symptoms at any time while taking this drug. Older adults may be at higher risk for this effect. If you experience stomach or abdominal pain that doesn't go away, bloody or black/tarry stools, vomit that looks like coffee grounds, chest/jaw/left arm pain, shortness of breath, unusual sweating, weakness on one side of the body, sudden vision changes, or trouble speaking, stop taking indomethacin and seek medical help right away. Always talk with your doctor or pharmacist about the risks and benefits of treatment with this medication. The daily dosage and optimal timing of taking this medication should be discussed with your healthcare provider. Before taking indomethacin suspension, it's important to let your doctor know if you have any allergies, especially to aspirin or other NSAIDs, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor, including any history of asthma, bleeding or clotting problems, heart disease, high blood pressure, liver disease, or stomach/intestinal/esophagus problems. Kidney problems can sometimes occur with the use of indomethacin suspension, especially if you are dehydrated, have heart failure or kidney disease, are an older adult, or take certain medications. Drinking plenty of fluids as directed by your doctor can help prevent dehydration, and it's important to tell your doctor if you notice a change in the amount of urine. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Additionally, daily use of alcohol and tobacco, especially when combined with this medication, may increase the risk for stomach bleeding. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Indomethacin suspension may make you more sensitive to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. It's also important to notify your doctor if you experience sunburn or skin blisters/redness. Older adults may be at greater risk for stomach/intestinal bleeding, kidney problems, heart attack, stroke, and mental/mood changes while using this drug, and children may be more sensitive to the side effects of this drug, especially serious liver problems. For women of childbearing age, it's important to discuss the benefits and risks with your doctor, and to let your doctor know if you are pregnant or plan to become pregnant, as this medication may harm an unborn baby and cause problems with normal labor/delivery. If using this medication between 20 and 30 weeks of pregnancy, it is recommended to use the lowest effective dose for the shortest possible time, and it should not be used after 30 weeks of pregnancy. This drug also passes into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential interactions with other medications when taking indomethacin suspension. This includes drugs like aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, lithium, and certain water pills. It's also important to be cautious when taking this medication with other drugs that may increase the risk of bleeding, such as antiplatelet drugs and blood thinners. Be sure to carefully read the labels of all prescription and non-prescription medicines, as many may contain pain relievers and fever reducers that could interact with indomethacin. It's also important to note that this medication may interfere with certain lab tests, so be sure to inform your lab personnel and doctors that you are taking this drug. As always, it's important to speak with your doctor or pharmacist about any concerns or questions you may have about taking indomethacin suspension. And if your doctor has prescribed low-dose aspirin for you, it's important to continue taking it unless told otherwise. If someone has taken too much indomethacin suspension and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, vomiting that looks like coffee grounds, extreme drowsiness, slow or shallow breathing, confusion, and seizures. If you or someone you know is experiencing these symptoms, seek medical help right away. Remember not to share your indomethacin suspension with others. It's important to have regular medical and lab appointments, including tests for blood pressure, complete blood count, and liver/kidney function. Your doctor may also recommend non-drug treatments, such as weight loss and exercises, to help improve your flexibility, range of motion, and joint function. Always consult your doctor for specific instructions and advice on the best time to take this medication. If you are taking this medication regularly and you happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, then it's best to skip the missed dose and just take your next dose at the regular time. Do not take a double dose to make up for the missed one. When storing indomethacin suspension, it's important to keep it at room temperature and away from light and moisture. Make sure not to freeze it and avoid storing it in the bathroom. Always keep all medications out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Properly discard the suspension when it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the correct disposal method. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.